A week has passed since we exited the circuit breaker. There has indeed been some increase in the number of daily cases in the community, but as you can see, it's partly due to our stepped-up testing regime. On the whole, our assessment is that the situation over the past week remains under control, and the new daily cases are within expectations. Some people ask, but I'm going to work and I already see many people on public transport. So if that's the case, why can't we open up relax the measures for me to see more of my family and friends? I understand why these comparisons are made, but I think we need to better understand that the settings and risk are very different. In public transport, the fact that we are allowing people to return to work, to go back to schools, means that inevitably there will be more people using public transport. And when that happens, it will be hard to maintain that physical distance between one another. And that's why we take other precautions, including wearing of masks, including requiring people not to talk when they are on public transport, and step up the cleaning of the trains and the buses. These are transient risks, but with these additional precautions, we are able to minimize the risk further and ensure that public transport journeys are safe. But social interactions are of a different magnitude of risk altogether. When we gather together, whether to talk, to interact, to have a meal together, the risks are much higher. And the evidence we have for cases in Singapore and also the evidence around the world shows that the vast majority of cases, of infected cases, are typically spread by these few events that involve social interactions and gatherings. And that's why we have been much stricter on limiting such social gatherings in phase 1. We have safe management practices and measures in these settings, but overall we remain quite tight, particularly in terms of limiting social interactions and gatherings. And if we all do our part to comply with the measures in phase 1, we will be able to keep community transmission low and stable throughout this period, and it gives us a much better chance of getting into phase 2 early.